something we see day in and day out. Gun violence all across the country. In some cases, the victims are children.
Those kids not only deal with the physical toll, but the mental trauma, too. CBS News Miami's Chelsea Jones spoke to doctors to find out what those children are faced with and how parents can help.
Whether it's a shooting in a school or on the beach, there is a long list of victims under the age of 18 that have been hit by bullets. Pediatric surgeon Dr. Oliver Loud knows it all too well, serving adolescent patients at Joe DiMaggio Children's Hospital. He tells me the injuries are never only as they appear on the surface.
The internal blast injury and because of the tumble of the projectile and the bullet, it can cause so much injury on the inside that you may not be able to see on the outside.
The actions Hollywood police say bystanders took to help aid the 9 gunshot victims on Memorial Day is exactly what can buy a child minutes of survival.
And whether that's a tourniquet, whether that's packing, whether that's just holding pressure with your hand, that can save someone's life.
Giving that patient time to get to the hospital. But Dr. Loud says it's not only the physical injury at risk when it comes to children.
The thing we worry about kids mostly is their growth and development, both physically and then psychologically and emotionally.
Generally, children do not form memories before the age of 3. So it may be something that impacts his parents more than it impacts the child.
Dr. Daniel Bober is chief of psychiatry at Memorial Hospital. He says infants and toddlers can't always communicate, so a change in bowel or bladder habits could signal trauma for children in that age group. For older kids,
maybe they won't go to school because they have a stomach ache, or maybe they'll say, you know, I have a headache, or they what we call somaticize their symptoms. They don't talk about them. They may get in fights at school. They might, you know, put holes in the wall.
If it's not addressed, Dr. Bober says the trauma can manifest in adulthood to trust issues and problems with people interaction.
Kids who deal with serious trauma, it can actually cause changes in their immune system via inflammation, and they can develop not only depression and anxiety later on, but even obesity, heart disease, cancer, all from trauma that they have not dealt with.
As for long-term physical damage to a child who has been shot, the impacts are case by case.
There are also certain parts of the body, especially bones, for example, that growth plates that we want children to continue to grow, and if a bullet or a projectile or something damages those growth plates, that can damage a child long term.
According to Dr. Bober, research shows that over 35% of parents who have a seriously injured child, they can develop a stress disorder. His advice for parents is to stay open and calm and also never judgmental. And if you see that your child's daily activities are affected by that trauma, he says seek professional help. In Hollywood, I'm Chelsea Jones, CBS News, Miami.